in the British Journal of Dermatology, and this study was an overview of the network meta-analysis evaluating the efficacy and the safety of the systemic treatments to use in moderate to severe psoriasis. So I've heard the previous speaker, Christine Fahim, and it was really interesting to talk about dissemination and the spread of awareness regarding some research findings and recommendations. So I think this presentation will be in the line of this message, and the opportunity to talk about an observation that is not only limited to dermatology, but also other research domain, that is the proliferation of network meta-analysis, and most importantly, redundant network meta-analysis. So as you all know, psoriasis is a chronic inflammatory skin disease, and for which many systemic treatments have been made available in recent years, thanks in part to the rapid development of biological treatment. But the efficacy and the safety of these different treatments between one and another is really important for healthcare practitioners and patients, as it guides clinical decision. However, the randomized controlled trials that have been made to evaluate this treatment have mostly been made against placebo, and direct comparison between the treatment is often lacking. Following a systematic review, network meta-analysis is a statistical method that allows the comparison of several treatments in a single analysis by combining both direct and indirect evidence. The direct evidence are directly extracted from the randomized controlled trials, when indirect evidence are mathematically deduced when two treatments, A and B, have been compared to a common comparator, C. Network meta-analysis thus allows an estimation of the relative treatment effect between every treatment that are included in the network, even the ones that have never been compared directly in a trial. Network meta-analysis also allows an estimation of the ranking of the interventions that are included, given a specific outcome. Due to its usefulness in comparative effectiveness research, network meta-analysis has gained a lot of popularity, and this popularity has led to an increase in the publication of network meta-analysis in many research fields. And this proliferation has led to the publication of many network meta-analyses that were overlapping, redundant, and with sometimes different results or even discordant results. And we wanted to evaluate if this phenomenon, this problematic, was present in dermatology, and more specifically, for the evaluation of the systemic treatments used in moderate to severe psoriasis. Our objectives were the following: to assess the number per year of redundant network meta-analysis, to describe their characteristics, and to compare their differences. So we conducted a systematic review based on the protocol that were registered before the start of the study, and we followed the recommendation of systematic review, and we tried to include all systematic reviews with network meta-analysis of randomized controlled trials that included adult patients with moderate to severe psoriasis that evaluated the efficacy and the safety of the systemic treatment that were compared with a placebo or an active comparator. The study identification and selection was made in duplicate by two independent authors on several electronic databases. Our main outcomes were the following: the number per year of redundant network meta-analysis and the description of the overlaps. The secondary outcomes were the evaluation of the certainty of the evidence using AMSTAR2, the evaluation of the presence of spin in the abstract using a modified version of the classification by Yavshitz et al., an evaluation of the reporting, of the quality of the reporting in the abstract using Prisma abstract, and we also evaluated the ties with the pharmaceutical companies, the agreement between the network meta-analysis conclusion, and the effect of funding on the presentation of the results. For our primary outcomes, what we found is that we included 47 network meta-analyses that all evaluated the efficacy and safety of the systemic treatment in moderate to severe psoriasis, and were all considered redundant. We observed over time an increase in the number of redundant network meta-analyses published every year, with a maximum of 12 network meta-analyses published in the year 2020 alone. What we also observed is that most network meta-analyses only evaluated a fraction of the available treatment and only evaluated the short-term efficacy. Indeed, 30 network meta-analyses did not include non-biological treatments, only 5 included all treatment classes, and only 2 included all available treatments. I have to say that in the 47 network meta-analyses that were included, 2 of them were Cochrane systematic reviews with network meta-analysis, and those were the 2 that were comprehensive and included all available treatments. Efficacy was evaluated in 45 of the network meta-analyses, but efficacy and safety in only 14. The short-term outcomes were evaluated in 39 network meta-analyses, but both short-term and long-term outcomes were evaluated in only 5 of them. As for the secondary outcome, the evaluation of the methodological quality using Abstract 2 revealed that most of the network meta-analyses that were included provided results with a very low or low certainty of evidence, with 39 network meta-analyses that provided results with a very low certainty of evidence. This was due to the fact that many of the network meta-analyses did not provide or did not report some of the important steps required for systematic review and meta-analysis. For example, 39 did not register a protocol, and 16 did not evaluate the risk of bias of the included studies. Spin was present in all of the abstracts, and one of the most important spin that we found was the selective declaration of efficacy that was found in 30 out of 47 abstracts of the network meta-analysis. We evaluated the ties with the pharmaceutical companies, and more than half of the network meta-analyses were funded by the industry. We also found that 18 of them relied on the contract research organization that was funded by industry. The contract research organization is an organization that helps the author during their statistical endeavor. We also evaluated the declaration of short-term efficacy, and we found some discrepancies between the conclusion of the different network meta-analyses. And we found that even network meta-analysis that included the same treatment, published the same year, stated different treatment as being the best. And even though it was not statistically significant, we found an influence of the funding on the declaration of efficacy regarding the molecule stated as being best. Indeed, when the network meta-analysis was funded by industry, most of the time, they only declare one molecule as being best, their own, and when they cited multiple treatment as being best, they always started by citing the molecule that was produced by the funding company. Overall, the key messages of this study are the following: that we witnessed an increase in the publication of redundant network meta-analysis every year over time, in the evaluation of the systemic treatment in moderate to severe psoriasis. But between the overlap and the similarity between them, we also found that only 2 of them were comprehensive, and those were the Cochrane systematic review with network meta-analysis. And most of the network meta-analysis only included a fraction of the available treatment. We also found that the network meta-analysis provided low certainty of evidence due to methodological flow and lack of reporting, and we found some discrepancies between the conclusions. So what can we do about this? So we see that there are a lot of network meta-analyses that are flawed with a lot of methodological flow or gap, and this is not only limited to dermatology, but also other medical domain. And the discrepancies that we found in the conclusion might be explained in part to the difference in the methodological choices that the network meta-analysis made. Indeed, we found that network meta-analysis that we included only evaluated a fraction of the individual treatment, and it has been shown in the past that this influenced greatly the result of the network meta-analysis because of the influence on the network. What needs to be done now, because we've talked just before about the spread of information, the raise of awareness, and the dissemination of information, is that the recommendation on network meta-analysis are accessible. It's a very rigorous and a difficult method, but the flow that we saw here during this overview were sometimes on very basic methodological considerations, such as protocol registration, evaluation of on the risk of bias, or even the comprehensiveness of the systematic review. And there is an important message here to raise awareness on the methodological recommendation regarding network meta-analysis, to the readers, to the clinician, but also to the editors that receive the publication of this kind of network meta-analysis. And the next step will be to better understand the real impact of those methodological choices that were made in the network meta-analysis on the result of the network meta-analysis. To what extent does the decision on the inclusion or not of a treatment have on the efficacy appreciation of a treatment? This needs to be further evaluated in a future study. Thank you very much.
Great, thank you very much, Robin. I'll open up to questions, see if anyone in the audience has any questions. So, I mean, I guess my main question, and you sort of started to address this, we know with your last slide, is, I mean, really, you know, what can we do, right? Like, we can't stop people from, you know, publishing a network meta-analysis. You know, we can encourage best practices. Ultimately, you know, there's so many dermatology journals. These things it's going to get in somewhere. You know, if someone does a network meta-analysis, even if it's not great or has problems or, you know, it's not registered. So, like, what do you think can be done to, or you know, or does anything even need to be done? And we can just we should just accept that these are going to be out there, and hopefully, at least, you know, the better, more impactful journals don't publish them. But what do you think?
Yes, it's a really interesting question, because just before we were talking about dissemination and the impact of dissemination. Does it work? What is the actual influence of dissemination? We have to raise awareness to editors so that they can better judge the quality of a network meta-analysis based on the recommendation that exists out there. But as you said, it can be published in another journal, and it'll be published anyway, because it's a really popular method, and I think a lot of journals want to have it published. And then if it's published anyway, that's where we have to raise awareness to the readers. Of course, there are some readers that are naive of this statistical method, that is really challenging to interpret. That you really have to understand the way a systematic review works, a meta-analysis, and then a network meta-analysis, which adds layers of complexity. But we have to hope for the best, I guess, when we try to raise awareness to the readers and make sure that the recommendations are available, that they know what to look for. And the first step will be just to check if the network meta-analysis is comprehensive or not. That will be a first step, because we found that a lot of them were not. And since it has been shown in the past that this can have an influence on the result, to be aware that probably if there is a more comprehensive out there, maybe check if the results are similar, or are the conclusions the same. I think the discrepancies between the conclusion makes it more difficult to interpret the conclusion. You have to really go into the result and see for yourself. But I believe it will be a slow process, but there is more and more publication that raise awareness to this problematic, and not only in dermatology, but also in rheumatology, for example, or gastroenterology, where there are a lot of systematic reviews with the meta-analysis and network meta-analysis. I think over time, people are going to be more exigent to what the methodological quality of a network meta-analysis is. For example, the registration of a protocol would be a first and easy step to implement, but yeah, it's challenging.
Thanks, and I think we'll take one more question from Bob.
Thank you, Robin, for a lovely presentation. And it's a nightmare, isn't it? I think I was struck by the point you had. You know, that many of the network meta-analyses have no protocol and no risk of bias assessment as being the main. So for me, I think a simple message for someone editing or peer reviewing a network meta-analysis is to just, you know, and it's the same with systematic reviews really. If there's no protocol and or no risk of bias assessment, it's going to be really bad, you know.
Yeah.
And I mean, those are very low bars to get above. Once you're above that, then you can look at, you know, was the risk of bias actually, you know, incorporated in conclusions, etc. But I think, you know, protocol, risk of bias assessment are very basic, and it looks like you can discard a lot of NMAs on that basis. Is that right?
Yeah, exactly. Yeah, we were struck, even though network meta-analysis is recent and needs a lot of statistical consideration. Those steps are really basic, as you said, and they come before the network meta-analysis. Is just the systematic review process, and a lot of the methodological flows that we observed were not necessarily on the network meta-analysis part, but on basic steps: registration of the protocol, evaluation of the risk of bias, and indeed, it's almost 90% of them that could be discarded looking like this. And I see that in the Q&R, someone said that in high impact journal, no publication of network meta-analysis funded by a pharmaceutical company. Obviously, we were also struck by the fact that the efficacy statement in the conclusion was highly influenced by the funding of the network meta-analysis. It's always in favor of the treatment that is produced by the pharmaceutical company that is financing the study. We cannot prove it in this article on the statistical level, but it's striking, and it's hard to believe that it's only a matter of luck, that it always ends up the same way. I don't know if this measure could be implemented to just refuse network meta-analysis that are funded by the industry. But every industry now has its own network meta-analysis that says my treatment works best, which makes it really hard for the evidence-based medicine to justify that the fact that network meta-analysis should be on top of the hierarchy of evidence-based medicine. When you see that there is this kind of discrepancy, you want to go deeper and understand where the flaws or the biases are.